Hi, my name is Amanda. I am a type 1 diabetic. I am not a licensed doctor or certified nurse. If you have questions about your own diabetes management, please contact your physician. Hi guys, it's me again. Welcome back. Today I'm going to be talking to you about infusion sites. One of the main reasons I feel like I have hyperglycemia is because of a bad infusion site. That can be due to it being bumped, not properly inserted, having an occlusion, having tissue or blood clot blocking it. It could be too old. Most infusion sites only last around 3 days. I consider myself lucky if I get 2 days out of them. They're usually placed on the arms, legs, back, and abdomen. In some of my Facebook groups that I'm in, a big topic is where do you put your infusion site, and some of the brave souls that I've seen and where they can place them. I'm not sure how they do it, but some people place them on their calves, on their chests, anywhere you have fluff is basically what my diabetes educator told me. If you can pinch it, there's enough fat there for an injection, then there's enough fat there for an infusion site. I changed mine today because it was on my left arm and I switched it over to my right arm because I was going up. I was around 200 and knew that there was no reason for me to be that high. So tomorrow was going to be my third day, so I was like, I'll just go ahead and change it so I can maybe have a smooth night tonight and not be woken up by any of my CGM alarms. So I changed it after I took a shower and went to do chores, and boop, it just popped right off my arm like nothing was holding it on. I did use a barrier wipe because the adhesive on this one, it's a pretty large square inch wise for adhesive, and ripping it off usually is pretty painful and leaves a mark on my skin. But yeah, those barrier wipes, I'm not having good luck with them. So I'm going to place an infusion site for you to see the process, this time on my abdomen. I have a Animas Vibe insulin pump. I got this about a year and a half ago. I've always been with Animas. I upgraded from the Ping to the Vibe because it had the integrated Dexcom CGM. I was only able to use the Dexcom for like 3 months until my insurance quit covering it, but loved it when I did use it. The Animas is actually, I guess, going out of business. I don't know, selling their company, not quite sure. But supposedly sometime next month, I will be getting a Medtronic insulin pump. They're referring all of their patients who are still in warranty, like me, to Medtronic. So we shall see about that. I am currently using the inset 30s. They go in at a 30-degree angle. I do not prefer these. These are what I could get my hands on. It's really hard to get your hands on Animas supplies right now. They're no longer making them, of course, or their pumps. So if something was to happen to this one, even though it's in warranty, I'm not sure what could be done if I'd get a replacement or not. I prefer their version of quick sets, which just go straight into the skin and not at an angle into the skin. These were great during my first pregnancy. I was a lot thinner back then. Other pump companies sometimes call these silhouettes, but these are called inset 30s with Animas. So you take that off, take off that piece, and this pulls apart like so. It's spring-loaded. There's a little piece right here that you pull back, kind of like a trigger, and that loads it. I don't know if you can see that. That loads it, that pulls it back into that little case. It's supposed to lift up this little piece of plastic here that's covering some of the adhesive. There we go. There's a little piece of plastic. It comes off the bottom of the adhesive so that some of the adhesive around the window, around that little window, comes off so that there's hopefully something to stick onto it, onto your skin, to keep it on there. I have issues with these. Usually my husband has to put his finger down on it while I pull the insertion needle, which is right there. That just inserts the cannula, which is, I'm not sure what it's made out of. I call it plastic. Right there. The cannulas come in different sizes. These I believe are 6mm. I can use, or I also use 9mm. I don't really care about on my arms. I prefer the shorter ones on my arms. So I've been trying to utilize my arms recently and give my stomach a bit of a break. I have lots of scar tissue and stretch marks from having 2 babies that I can't insert to, and eventually, after years of, because I'm coming up on my 15-year anniversary next month actually, you get little fat deposits, little fat pouches underneath your skin. It's super attractive. Diabetes is so pretty. Okay, so let me show you the area that I'm going to insert into. Right there, any place without, you can see I had an old insertion site right there. My stomach's pretty much covered with these little bumps. I'm using a brand new lotion from Limelight by Alcone, and it has helped enormously. Their 40 Cure Cream is what I use, and I'm loving it, how fast I heal. But yes, I still get those little bumps. So you want to try to find a spot where you don't have a whole lot of stuff going on. Rub it down with the alcohol wipe. Now I do know that, so my cannulas are plastic or whatever it is that they're made out of. There are some that are steel, because there are a lot of people who have allergies, and some companies make certain insets with certain adhesives, just specifically for people with allergies. Gotta let that dry. That might have been my downfall on my last site. You gotta let it dry or else it's not gonna stick. You gotta make sure you don't moisturize. I did put on a lotion after I inserted it, so who knows what's going on. But luckily I was trending down at 104, so thought this would be a good time for impromptu video. Okay, pinch up the skin. There's a little flat piece on here that you're supposed to flush up against your skin. That doesn't work too well for me. I like to kind of bend mine and angle it down a little bit more. Like I said, I am used to using 9mm quick sets, so with these being 6mm and at an angle, I don't feel like I'm getting the depth that I need for good absorption. So I angle mine just down a little bit, and after you've cocked this back, there's this little circle on the bottom and on the top of the inserter, and all you have to do is squeeze. I like to brace myself up against something, because sometimes you get those stingers and they can take the breath out of you. So I brace myself up against something, take a big breath in and a breath out, and press in. Now with these, I put my finger right over that window and pull that insertion needle out. That does not stay in you. Thank goodness. The only needle I'll have to deal with for another 2 to 3 days. Not too bad. Alright, now these, you know, you have to rotate your sites, give your skin a break. You're not supposed to insert anywhere within an inch or so of your belly button. I'm not sure why you'd want to anyway. That sounds kind of painful, but a little fact for you. So make sure that's down. Make sure there's no bleeding in the window. I do like these for the window. The ones that I use, you know, the needle goes right kind of through this plastic connector piece, so I can't see if anything's going on. Take off that sticky back piece. Take off this big old sticky back piece. Press everything down nice and tight. Some people like to tape over their sites. Some people use special IV film. I like to have access to it, see what's going on. I do experience a lot of leakage, like I said, so, and too much tape down on my skin, I'm just going to have to rip it off, and then that's way more irritation. I get so irritated from medical tape, so then we're going to take our pump. These tubings for this one come in a separate package. My pump already has insulin inside of it, and the battery is low. My pump has 85 units, so that's a good day and a half, so you know, I don't need to refill it. But I will need to fill the cannula. You've got to fill that little tube inside with insulin, kind of prime it almost. So these just kind of click in like that. They come with little covers if you, you know, want to go to the beach, don't want to get sand in here, you snap in a little cover, and then there's a little cover for this piece too. I never use them. Lots of people find them super handy. On my Animas Vibe, I go to menu and scroll all the way down to prime and rewind as if I was going to fill the cartridge. We're going to fill the cannula though, right there at the bottom. I believe this cannula, if I can remember back from my diabetes education, is 0.4 units. So a little under just half of 1 unit. Super, super small. And that the 9 millimeters, I think, are 0.6 units. Press go. And cannula filled. Hopefully this one will stick and I won't have any more issues for the rest of the evening. So that's about it. I plan on making another video here soon once I compile some information about the transmitter that I use for my Libre sensors to turn it into a real-time CGM just like the Dexcom. It's called a Bluecon Night Rider by Ambrosia Systems. You can visit their website at www.ambrosiasys.com. For more info, that's where I bought mine. Some people are selling them on eBay, sometimes Amazon has them. But yeah, go take a look over there. There's lots of information, and I will see you next time. Good night.